So again, thank you so much for attending our Advocacy Day. We appreciate you taking the time to come down to Springfield as well as listen in on the call today. Our goals really are to review the kind of advocacy agenda as well as just some government basics. So some more dry material around how a bill becomes law, but it's still important to know. As well as just a review of how we determine advocacy priorities and bills for the year, and then a review of our general kind of Medicaid, our topics, which will be a broad focus on Medicaid as well as immunizations. We will have some more specific bills. We're in the process of determining those based on kind of how things are shaking out this week in Springfield. So a few things to note. One, we will send this presentation over to everybody. And now that I hit record, we'll also make sure that people have the recording if they're not able to attend the conference today. We will also make sure to send out, our goal is to send out fact sheets for review by Friday, probably on Friday. We'll send out those fact sheets for legislation as well as our general topics. So you'll have plenty of time to review them before Wednesday's conference. On Wednesday, we will go over this, not this, but over the topics again, so people feel comfortable and can ask questions as well. So don't feel like this is your only time to review or understand anything at all. So we will wait and do questions at the end. There is a place where you can type in questions, and you could also raise your hand and I can unmute you as well to ask questions moving forward. So we're just going to go ahead and get started. So a quick thing to note about ICAP and the AAP, which is a little different than kind of other advocacy organizations or professional organizations. So really the mission of both ICAP as well as AAP is all about the health and well-being of children, infants all the way through young adults. And that makes us a little bit different than other associations who may be more focused on the profession of the association they represent, so might have a more narrow agenda, or other partner organizations who may tend to only focus on one aspect of children's health. So our mission does tend to be very broad. Our advocacy agenda makes it very, very broad. So we are asked to weigh in on a wide variety of bills, anything from access to diapers, through child abuse legislation, through young adults and access to care issues. So we do have a much broader agenda than other groups, which means that we do work with a wide variety of different organizations to move our advocacy forward. So just something to keep in mind when we talk about bills, that it can get a little overwhelming. So we do our best to prioritize bills that both would have a large impact on children's health and the ability for our members to provide care for children, as well as how we feel that they will move through the legislature as well. So a quick review of the basics. So we have 3 branches of government in our state. So the executive branch is headed by the governor, Bruce Rauner, and the lieutenant governor, which is chosen by the governor, is Evelyn Sanganutti. So the lieutenant governor in Illinois actually doesn't have a job. They're more of a figurehead. They don't have any kind of legislative power. In the past, they basically take over if the governor leaves for some reason, which in the history of our state has happened fairly recently. So they are powerful that way. It is also important to note that the governor appoints the heads of the state agencies. So in some cases, sometimes we think of the state agencies as just operating on their own because of the staff in them, but we need to remember that they really are arms of the governor's office. The heads of those agencies and fairly down below them are appointed by the governor, do answer to the governor, and really speak on behalf of the governor. So it's important to remember that as well. The other elected officials that make up the executive branch are the Attorney General, which is Lisa Madigan. So the Attorney General is basically the lawyer for the state. So in some cases, you'll see the Attorney General actually issue statements that are against the governor. So they do act independently, and that is the case in all state governments. There are many cases throughout the country where the Attorney General might be on one side of an issue and the governor on the other. So they do operate independently, but they're basically at the base level the lawyer, right? So they sue on behalf of the state, defend the state in lawsuits if necessary, really try to hold up the laws of the state. The Secretary of State is Jesse White. I always say Secretary of State is paperwork, so it's not only the driver where you get your driver's license, but they're the state archivist, and they're in charge of the code and all of those things. The comptroller is currently a more powerful position here in Illinois. So the comptroller is the person that essentially issues payments for the state. So we think of them as in charge of your checkbook. So we see since that seat turned over from a Republican to a Democrat for Susan Mendoza in January, we've seen those statements become much more political. So there's many more clashes with the comptroller and the governor around issuing of payments, which really has to do with the lack of the state budget in Illinois. So 90% of the state bills are paid by court order. However, because it was not an increase in tax revenue related to that, we are paying bills based on a 2014 budget and a 2014 tax rate, but our tax rate has actually expired. So there is physically not enough money in Illinois to pay Illinois' bills. So that's where you hear the debt come up. That's why we know that HFS hasn't been paying MCOs, because there is not physically enough money for the comptroller to issue payments to those agencies. The treasurer is essentially the state investor, so stocks and bonds and things like that. And so they're basically, if you think of them like, is in charge of your investment accounts. The judicial branch is essentially headed up by the state Supreme Court. I think everyone knows, but in case you've never voted in Illinois before, all judges in Illinois are elected. They do run on a partisan ticket. So when we go to Lobby Day, we're really going to be lobbying the legislative branch. So we'll be in the General Assembly meeting with Senate and House members. And this is just a snapshot of what that looks like. So in the Senate, there's 37 Democrats and 22 Republicans. So the Senate is elected, they have staggered terms around every 4 years. So it's not that every senator is up every year, which is what we kind of see in the House. So it just makes for a kind of different atmosphere in terms of getting legislation passed. The majority leader is John Cullerton, and the minority leader is Christine Radogno. There are 29 committees and then 29 subcommittees within the Senate. So that's almost 60 full committees. So there's a lot kind of going on. You'll see down in the House, there are 67 Democrats and 57 Republicans. So one of the different things about the House is that the whole House is up for election every 2 years. So it is one of the reasons that we see the first year of the General Assembly, which is what we're in now, be a little bit more active than the second year, because in the second year they're really running races. So there's the primary in February, and then the final election in November. And so the House tends to get caught up with focusing on keeping their own seats the second year as well. I think everybody knows this, but the majority leader is Michael Madigan and the minority leader is Jim Durkin. You'll see a huge proliferation of committees in the House this year. There are 58 committees and around 58 subcommittees. I think I might have missed a few when I was counting, but there are a lot of committee meetings and hearings going on, and we'll go over why that's so important in a moment. So as I said, the General Assembly, which is made up of the Senate and the House, meets for 2-year terms. This is the first year of the 100th General Assembly. They meet from January through the end of May. After May 31st, you need a supermajority for anyone to pass, legislation to pass, so it's why you see a lot of flurry of activity between January and May. They're generally in session Tuesday, Wednesday, and Thursday, and then in November or December, they have what we refer to as veto session. So there's usually a few days of session. It's usually 2 weeks. It's usually 6 days. And this is traditionally the time when they address any vetoes by the governor. It is also a time where we see legislation move very quickly through the House and Senate and try to get votes, basically to get everything out before January. There is sometimes a few sessions in January, which we refer to as the lame duck session, because that's usually, if there's a leaving from an election, that's when the last session will be. So here is a review of how a bill becomes a law. Okay, so a bill is introduced and assigned to a committee. So one of the reasons we're always tracking committees is this is really where the action happens. There are deadlines for all the bills to be out of committee, which for the Senate was March 17th, and for the House is March 31st. So it's one of the reasons that we're still holding back to see where bills are on Friday before we determine what bills will essentially still be alive and voted on by then. So committee hearings happen fairly often, and it's where bills are really heard for the first time. It's where people can come and testify and provide guidance to legislators about why they feel a specific way about a bill. It's where, as an organization, you can weigh in on legislation. So this is where we file witness slips stating whether ICAP is for or against a piece of legislation. We do, if needed, testify in person. You can also submit written testimony, which we sometimes do as well. Committee hearings are often also where sometimes you'll hear us talk about subject matter hearings. So a few weeks ago, for example, the House held a subject matter hearing on the impact of proposed Medicaid changes on the federal level. So that's a place where we could submit testimony where it's just about one specific subject where they're not necessarily voting on legislation. So this is also a place where you really see a lot of people put out action alerts. They might send emails to, in our case, to members or to volunteers asking them to file witness slips, which anyone can do. They're electronic, so they're very easy to do, or to call their legislators and ask them to vote a specific way on a bill. We really see the proliferation of filing witness slips is really kind of where all the action lies, and I can show you what that looks like towards the end of the call, but so anyone can file a witness slip, and what that means is that basically your name is read into the record and stating your position on the bill. So whenever they hear a bill within the committee, it starts with there are 30 slips in support, 20 slips opposed, and 1 slip neutral. So they read that. And then oftentimes the legislators are provided a list of those who have submitted witness slips. If the bill does make it out of committee, that list of who filed witness slips also goes to the full chamber, so they can see who has filed slips on bills. If a bill does make it out of committee, it goes to a second reading. This is really where we'll see most of our bills when we get a spring bill. They'll be in second or third reading. Really the big difference is in second reading, they'll amend. That's really when they amend a bill, and then third reading is really when it's a chance to vote. So if a bill is amended, the amendment goes to committee and then comes out and is attached to the bill as well. So that's often another time we're involved with that. And then this whole process repeats itself in the other chambers. So if it starts in the House, it goes to the Senate. If it goes in the Senate, it goes to the House, all with the same kind of goals and deadlines. So the idea is that all of the bills are voted on both chambers by May 31st. If it does get approved by both chambers, it goes to the governor, who can sign it into law. And then he can also veto the bill. So there's a lot of different ways that the governor can veto legislation, which are listed here. I won't go too much into them, but amendatory vetoes are essentially where they suggest changes to a bill. Itemized vetoes are really for appropriation bills only, so bills that contain cost centers for money, where they can actually cross out items within that budget, and then totally veto bills. And you can see that in the case of any veto, it all goes back to the General Assembly, who can vote to override the veto. Once it's signed by the governor, it becomes a public act and actually gets a whole new number, which I never learned, quite frankly. I still always refer to it by the bill number, unfortunately. I always have to look them up. But so it gets a new number. So bills this session will be Public Act 100 and then a number assigned based on when the governor signs it. They go through a rules process, which sometimes you'll hear us refer to as well through JCAR, the Joint Commission on Administrative Rules, which is a bipartisan group that reviews suggested changes to the rules coming from the State Department. So within legislation in and of itself tends to be rather vague. So it says you have to use EpiPens in schools, and what that actually means, and how that can actually play out in schools is determined by how it's integrated into existing state statute, and that's just kind of the actual laws of the state written down. So we're always looking at rules, usually 2 or 3 times a year. We're commenting on in support of rules or against rules. Many of you who are more involved with the chapter may have heard a lot about our rules regarding immunizations. So rules changes aren't always from legislation. The state departments can also make changes to their rules at any time. Luckily, we're not talking about that in Springfield this time. So our agenda. So how do we come up with these bills? Where do they come from? Hopefully these slides will help answer those questions. So as you know, we work with a lot of different organizations, so we're often contacted. We're always trying to identify potential bills before the start of session, which tends to be what we're working on in the fall of the previous year. So getting an idea of what people are working on, what they're thinking of, trying to identify where we can partner with other groups, what bills we can support. People contact us all the time asking us for our position on bills, and if possible, if we can sign on and support, because certainly the name of our organization does lend a big weight to those bills as well, knowing that they're supported by the pediatricians. And so what we do is we review we also review all the bills posted on the website. So there's about, I think there was about 8,000 bills, 6,000 bills posted this session. So we do look at as many of those as we can to try to pull out bills to figure out which ones we need to weigh in on. And we essentially put them in 2 piles. One is bills that we call SLIP. So those are essentially bills that we work. We file witness slips, we talk with legislators, we sign on to fact sheets. And then we have another chunk of bills that we call watch. So these are bills where either we don't necessarily have a position on, we don't think that they'll move, they might not be a high priority for us. And once bill deadline ends, so once bills have to be out of committee, we'll go back and look through those as well just to see what bills made it out of committee and review those to see if there's anything else. Usually to make sure something terrible didn't make it out of committee that we would really be opposed to, that we need to work on either amending or changing. So generally requests come into me, or in some cases Drew or other staff members, and we funnel them through ideally the legislative subcommittee that kind of reviews positions on bills and discusses those that might be more controversial, or the chair of the committee, Eddie Pont, who's been a long time chair of that committee, and when we need quick decisions, sometimes they just go through Eddie as well. 90% of the time, the bills are pretty clear as to what the position is, but if it is really controversial or something we're not quite sure how to address, or something that we feel like we need to weigh in on but can't come to decision within the legislative subcommittee, we might bring it up to the larger executive committee as well, so the board of the organization to review. We work with our lobbyists, who are Mike Kreloff and Sean McDermott, who are in Springfield. So not only do they help us with strategy, but they really reach out to the legislators that are on the ground folks down in Springfield as well. We do lend our name to coalitions, as I said, sending out action alerts, flipping, and sending support letters when necessary. So I'm going to give a quick review so this is from last week. So some of these have moved ahead, but this is kind of what we look at every time we're looking at bills. So you'll see in here where it says they list the house number, the sponsor, a brief title of the bill, the date there was last action on it, where it is in the House or Senate, and then where it is within that chamber as well. So you'll see below that if there's a committee meeting scheduled, and then in italics you'll see our position on the bill, and then where it says slip, like so for example here it says slip 215, that means that we filed a witness slip on February 15th. So you can kind of see where we are with that. I'll show you. That's not it. Hold on, screen. So this is our bill list right now, which looks fairly similar, but you'll see that bills are starting to move into subcommittee or not be heard. So for example, here's the pasteurized milk bill. It looks like it did not make it out of committee yesterday, which is good news because it is still assigned to the Consumer Protection Committee. So if it did not make it out of committee, next week we will, because committee deadline is Friday, next week we expect to see that this bill will be, what it'll say is referred back to rules, which means that the bill is dead and will not move this session without some larger administrative action. So here is a bill that we're following just to review how to look at bills when we send them to you. So at the top you'll see here's the bill number, a short description, who the current sponsors are, what the last action was, a brief review of what the bill is, and then if you scroll down you can kind of see what the action is. So you can see that in this committee we're really working on adding co-sponsors to this bill. That I happen to know that this bill will most likely not be voted on, but the goal is to have a subject matter hearing on it and really get as many co-sponsors on to set up for more legislation last year. At the very top where it says full text, if you click on that, it'll give you to the text of the bill. And anytime it's underlined, that's what is being changed within that statute. So you'll see here it says right under the bold, it says Section 5. This is what it's amending. The Department of Human Services Act is amending, and then this is what they are proposing to add to it. So it's anything that's underlined as well. Make sure that you are reading the most recent view of the bill. So if it has been amended, it'll say Amendment 1. You'll want to click on the Amendment 1 or anything that says engrossed. So sometimes that gets confusing because there's lots of amendments. I'm trying to think if I know of what, I think maybe this bill was amended. Yeah, okay, so here's an example of a bill that was amended right here where it says House Amendment 1. That's really where you want to look because that's the most recent version of the bill. So just as an FYI about that. Okay. I want to make sure if anyone has any questions, if they want to raise their hand or type them in before I go into lobby day. No? Okay. Moving ahead to lobby day. So where we'll be on lobby day. So as I said, bills need to be out of committee by the Senate and the House. The Senate was March 17th, the House on Friday. So most bills should be in second reading. However, because it's Illinois, there's always exemptions to that. So sometimes you'll see some bills that'll have extensions to those which are still in committee and will still be heard in committee. So we do expect when we're there that there'll be some committee action as well. The goal is to do some general advocacy. One, on the importance of immunizations. We have had some issues around immunizations in general, and as I think everyone is aware on the federal level, we've seen some larger anti-vaccination type rhetoric going, and we want to make sure that legislators feel comfortable about immunizations and have a chance to ask physicians any questions they may have or concerns. We do run into those in our state legislature. I would not say that we have a group that I would feel confident is very supportive of vaccinations, but certainly understand them, but there certainly are some that still have concerns or questions. The other is Medicaid. So with the introduction of legislation that unfortunately did not get a vote on Friday, which had significant changes to the Medicaid formulary within states, as well as current Illinois issues, as we always run into. It's a good time to just generally talk about Medicaid and remind legislators about the number of children that are really covered in Medicaid, and we'll go through that in a minute. Some other issues that we're looking at, probably talking about, is raising the tobacco age to 21. So that bill did make it out of the Senate last year, but they're having issues getting it out in the House. So we'll see where it stands, but we'll probably have some talking points in general about raising the tobacco age to 21. Access to diapers, so that was the bill I showed you before, but with recent articles in Pediatrics and the new focus on poverty within AAP, we felt that pediatricians would be a great spokespeople to talk about the need for a program where people can access diapers. So diapers are not covered under WIC, they're not covered by, you can't buy them with TANF dollars, so that's just general money from the state. You can't buy them with food stamps. So we see many families try to reuse them or use them as long as possible, which can be harmful to the child. The SMART Act is the tax on sugar beverage that we've been working on a lot, thanks to work from Mary Elsner, as well as the school bus seatbelt. So if you'll remember, there was unfortunately an accident over the summer where a child passed away. So there's been lots of activities in many states around mandating seatbelts in school buses. So here's a quick, this is our plan for the day. So we'll meet around 10:30 at the State House Inn. So we will answer any questions people have, talk more in general about the topics, discuss legislative strategies, and then we will break into groups based on both who your legislator is. We don't need, if we have 3 people in the same district, we'll put them together. And we will do our best to break into groups, also to make sure we include someone that may have done this before, so everyone feels more comfortable and has someone to ask questions to. We'll walk over to the Capitol. So the State House Inn is directly across the street from the Capitol. So we'll walk on over and visit with legislators. We'll probably all, it's not that big, so we'll probably all be there together, but breaking into groups when we can. And then coming back around 2:30-ish back to the State House Inn to debrief. So we will have some snacks at 10:30, and then at 2:30 we will have lunch for you. If you want to eat in between, there is a cafeteria in the state capitol, and you're welcome to stop by and pick up a snack or have lunch or anything like that. But just want to let you know that we will feed you, we promise, around 2:30. We do structure it that way because they do go into committee. And so around this lunch hour time is when you see more folks in their office coming into the Capitol for the first time and those types of things. So that's why we're focusing on that. So if you're taking the train in, this should leave you plenty of time to both take the train in and the train out. And if you're driving, this should also hopefully leave you plenty of time too. We will include this in the email, but you can easily park on the streets of Springfield. They are metered. And then what I will tell you is that if you don't refill your meter, your ticket is $5. So I would view that your parking is $5 for the day, but you're more than welcome to go back out and feed the meter as well. Okay, so some quick tips on talking to legislators. So first and foremost, don't assume. Most legislators do not really have a health background. They don't really know the details, certainly, that you guys know about health issues. They really might have zero idea about what a vaccine program is, what the state does for vaccines, what current law is. They just really don't know. So when you talk, make sure that you're talking, you might have to start your conversation with some quick background and basic information, just so everyone kind of knows what you're talking about. That happens to me sometimes. I leap in and then I realize in the middle of the conversation they don't understand other issues that I thought they did. So always making sure that they understand where you're going. Keep it simple. So, they don't need to be experts in everything. They just need to kind of understand, why you're asking them to vote a certain way. So you don't need to go too deep. And of course, unless asked, if they have follow-up questions, it might take a little bit longer, or you might have to provide a little bit more background information. But in general, you don't need to go too deep into an issue. Tell a story. If you have a good story from a patient or personal experience, please make sure not to violate HIPAA. Make sure to protect people's privacy. But how does this affect children? You see, everyone remembers a story more than they do kind of statistics. Listen carefully and find common ground. So you might not agree. It's okay to agree to disagree. That's fine. But really, everyone does truly care about children's health. So, you might have a different opinion about what that really means at the end of on a policy basis and a specific issue, but don't forget that they do care about children and how you can help them get there as well. If you don't know an answer, that's fine. It's not a big deal. It happens all the time. Just let them know. We're happy to get back to them, and either you can let Drew or I know, and we'll make sure to circle back with them with the information that they're looking for. Also remember to use children's first language. So this is, any issue can really be framed that we're talking about around the health and well-being of children first and foremost. So even when you're talking about Medicaid reimbursement or issues that might seem more to affect you directly, really it's about ensuring access to care. So, for example, if you're talking to a legislator about an issue around the Vaccine for Children program, yes, the issue is a little bit personal in that you might not be able to provide vaccines, but the broader issue is that because providers can't give vaccines, children first don't have access to them, right? So, when we're talking about VFCR issue, first and foremost is the lack of access to vaccinations. Now, the reason behind that is lack of reimbursement, but the first and foremost issue is the lack of access to vaccines and the impact that can have on children. So just remember to try to talk about children first, and then how pediatricians and how that affects pediatric care as well. So, topics. So first and foremost, make sure they understand where you're coming from so that you are a member of the Illinois chapter of the AAP. So these are just some quick facts about us. We are a statewide membership organization. We are a separate 501c3 from AAP, so we're a completely independent organization. We have about 2,100 members who include pediatricians, pediatric subspecialists, pediatricians in training, pediatric dentists, nurse practitioners, medical students, and really anyone can join our chapter, anyone that's concerned about children's health. Overall, our mission is to improve children's health, and what kind of issues in children's health that we care about? All of them. So that can focus both on clinical care as well as social determinants of health like poverty and trauma, and all of those things as well. So really letting them know that we do have a very broad agenda about what we're concerned about, and really first and foremost on how all of these issues affect children's health. So this first slide I just kept in, but this was about the American Health Care Act. So I did keep it in because it's not really dead. I think we'll still continue to hear a lot about repeal and replace of the ACA, and this really feeds into the issues around Medicaid and Medicaid funding. So although much of the conversation on amongst lots of folks were determined around the exchanges in ACA itself, the issues limiting Medicaid reimbursement or the changes in Medicaid would have been very detrimental to access to care for children in our state, and the ability of Illinois to continue to provide ongoing coverage for that. So making legislators aware, there's 1.4 million children in Illinois that are covered under Medicaid. It's 1 in 5 people all throughout the United States. So it's a very significant population. So anytime you're talking about changing the way it's funded, wherein states would have to put in more money, it's going to mean that states are going to have to cut services. So issues around per capita funding or block grant funding, anytime you hear the change that anytime there's a proposal to change Medicaid from being what's essentially now for Illinois a 50-50 match, meaning that whatever Illinois spends, the state pays 50% and the feds pay 50%, anytime you hear that change, it's going to mean that the state's going to get less money, and if the state gets less money, it's going to have to cut care. So in those changes, if they moved it from a per capita or to a block grant, that also means that our guarantees for coverage go away. So no more EPSCT, or early periodic screening, treatment, and diagnosis and treatment. No more of that, that it will be no longer federally mandated. No more parent payment guarantees, so those court decisions that we see that protect payments like the Minovsky will go away. No more waivers like home care support or the proposed 1115 waiver. Those will no longer be managed by CMS. Those would no longer be available. So just to keep that in mind on a federal level when they're talking about it. Here in Illinois, we of course always have some fun Medicaid things going on. So one of the big issues going on right now is the new RFP for the MCO. So as you'll remember, we have moved from fee-for-service into care coordination through Medicaid managed care. And in February, the state issued new RFPs. So those RFPs moved from being a regional-based program to a statewide program. So new MCOs have to be able to provide coverage for the full state. They also need to be able to do 1115 waiver information, which is coming out around coordinating of mental health care. And they're also specifically asking for information on how they would coordinate care for those children that are currently under the Division of Specialized Care for Children for DSCC. It also includes all foster children. So basically they're moving everybody into managed care, as many people as they possibly can. So although it's important to try to be positive when talking to legislators, so understanding that the concept of care coordination is something we support. We prefer that to be done through the medical office, but we do understand the importance of care coordination, the importance of making sure patients get what they need to keep costs down, to first and foremost to get what they need, and secondly as a goal to reduce costs. But we certainly still have concerns around the ability of HFS to manage these contracts within the MCOs, as we've seen play out with the current MCO contract. So within the RFP itself, we do have concerns around the ability and how the state is going to assess the ability of MCOs to manage those special populations, not only foster children, but especially those children that are still covered, whose care is currently coordinated under the DSCC. So the DSCC population, as you may know, are the most complicated children in the state and do require a lot of specialized care coordination for them, which is why they're under DSCC. So how the state is going to assess that without input from other experts does make us a little bit concerned. Also, the ability for any MCO to be able to have enough providers to cover pediatric patients throughout the state. So access to pediatric specialty care is always an issue. And certainly as this care gets fragmented into different MCOs, how the state is going to ensure that each MCO has an appropriate number of pediatric specialists to care for children. Is also a concern. Oh, and timing and credentialing. So also that they are making announcements about the MCOs in around the end of June, beginning of July, and then expect everyone to be back in open enrollment in October. So in those months, those plans will need to reaccredit and enroll new providers, and what that timeline looks like to be able to do that. You should also know that payments to MCOs have not been made in months. So due to the state budget, the state has not paid MCOs since either September or October, which means that MCOs are now beginning to cut off payment to providers. So we are back to where providers are simply not getting paid by current MCOs for that, and what that will continue to look like when they move into a full managed care situation is certainly concerning as well. Over the past year, we've also had changes to the Vaccine for Children's program, or the VFC program, which have required physicians to provide their own vaccines for children who are called Title 21 children, or children covered under CHIP. So in Illinois, we have a seamless program known as All Kids that includes both Medicaid as well as CHIP. But now CHIP children can not receive VFC vaccine. And so what that means is that because especially the smaller providers who have to pay for their own vaccine are simply not able to provide enough vaccine for the number of CHIP children in their practice. MCOs have not been paying in a timely manner for those, and especially now that the payments have been cut off, they're just simply not getting paid. And as I think anyone on this call that runs a practice knows, that can be hundreds of thousands of dollars, or at least tens of thousands of dollars that they're owed simply for a vaccine product. So here are some immunization talking points. These are just general things I think everyone on this call knows. The real message around vaccines is that vaccines are safe, vaccines are effective, and vaccines save lives. So this is really just an opportunity for providers to ask any questions they have, to remind them that we are paying attention to vaccines, and wanting to make sure that they are supportive of those efforts as well. This is just some review in case this comes up. Illinois has a medical and religious exemption in Illinois. We do currently require a certificate to include where the parent states their religious reasons for not allowing their child to be vaccinated. And then the provider needs to attest that they have given information and education to the parents on the risks of not vaccinating their child. The form also contains information related to when their child may be withheld school, like in the event of a vaccine preventable outbreak, such as mumps or measles. The form also contains that. So know that if you're outside of Chicago, you might not realize, but there is a mumps, I won't say epidemic, but an outbreak going on. So if you are in those areas, you might get some additional questions around that as well. Okay, so here's your homework. Review the fact sheets we send out. We have a beautiful fact sheet on Illinois Medicaid that AAP put together for each state. Think of stories, so especially on the topics I talked about. You know, if you have a patient or your practice, making sure you're using children's first language. If you haven't already, call your legislator and let them know that you will be there on April 5th, and hopefully let them know that you'd like to meet with them. If they want to set a time with you, great, but most likely they might just say, oh, find me, I'll be in my office. Remember to bring plenty of business cards. We do have blank business cards, ICAP business cards, so you can use those as well. And make sure to wear comfortable shoes. There is a lot of walking, and it is all marble. It is not the most forgiving of floors, so make sure to do that as well. So questions. So you can either type your question in here, or if you raise your hand, which is one of those options on that bar on the left side, I can unmute you. And we'll just wait to hear any questions. Oh. Oops.
Hello?
Go ahead.
Oh, hi. Hi, everybody. Thanks, Jenny and Drew. This is Kathy Sanabria, staff here at the ICAP. And I wanted to let you know with regard to what Jenny was discussing with the RFP to rebid Medicaid managed care. I did speak with Molly Hoffman, who is the new Associate Director of Care Coordination with the Division of Specialized Care for Children. I spoke with her yesterday. I was able to capture some of the concerns they have over at DSCC with regard to concerns that the work that they're doing may no longer, within 6 to 12 months, could be absorbed by the MCOs. So I'm going to write up the notes for that conversation and share them with Jenny. And these might be notes that could be pushed out to the group of people who are going to be attending Lobby Day. I also spoke with Meg Cooch, who is the new executive director of the ARC of Illinois, regarding the RFP. And so I could summarize some of their concerns as well. So I just wanted to mention that to you since this is a timely topic.
Great, thanks so much, Kathy, and we'll write those up and make sure to get those out to folks to talk about on that day. So one of the issues that we're running into with the RFP is that because it's in an open RFP process, we're not really able to, none of the state agencies can comment on that because they don't want to destroy the integrity of the RFP process. But so part of our mission, part of our talking points is just to make legislators aware of some possible concerns that we might have as this continues to roll out. Let's see. Thank you, Kathy. Hold on, let me pull my questions out so I can actually read them. Yes, thank you, Dr. Ashman. We will we'll be sending out a copy of everything on Friday for people to look at. We'll probably actually send out the PowerPoint today, but we'll be sending out the fact sheets and all of those materials on Friday for you to be able to look at. Any other questions? I don't see any other hands raised. Oh, Barb, I can't unmute you. You have to put in your audio pin or unmute yourself, I think. But if you type in your question, I would be happy to answer. But you're one, here, I'll send it to you again. But you have to put in your little pin. And then I can unmute you, but I don't have control over the ability to mute or unmute you. Any other questions? Well, Barb hopefully figures that out. Anyone else? Okay. Thank you, everybody, and we will see you next Wednesday. Have a good one.